The biggest concern with atrial fibrillation is the risk of clots and strokes. When the atria fibrillate, they're beating at 300 to 400 beats per minute, so they're not mechanically very active, and that leads to stagnation of blood in the atrium, and that blood can clot. That clot can break off, it can be pumped anywhere through the body, but to the kidney, the arm, the legs, or the brain. The biggest concern is the brain. Unfortunately, not everybody can take these anticoagulants. They're thinning the blood, and that can lead to bleeding. So one of the strategies to try and address this is to place, if you like, a little umbrella type device in the heart where most of the clots will form in somebody that are in atrial fibrillation. The area is known as the left atrial appendage. So this little device is deployed through the groin, up into the heart, and it blocks off that appendage. So any clot that forms in there cannot get out to the system and embolize, particularly to the brain, and cause strokes. So if we look at the heart, in this model we can see there's two ventricles, two atrium, but this appendage, this left atrial appendage off the top of the left atrium, is the area where a lot of clot can form in atrial fibrillation. In patients that cannot take anticoagulants, the option of deploying one of these devices, this left atrial appendage occlusion device, in this case a Watchman, but there are others, things such as the Abbott amulet. They are deployed up through the groin. A little puncture is made across in the heart to deploy this and block off that appendage. Now, the evidence is from multiple trials that this device is quite equivalent to being on anticoagulation at reducing the risk of clots and strokes. Unfortunately, anticoagulation or these devices do not eliminate 100% the risk of strokes, but it will significantly reduce them. And in patients that cannot take anticoagulants because of bleeding tendencies, this is a very good, safe option to consider. We have to be quite clear. These devices are not fixing or eliminating or treating the atrial fibrillation. Many of the patients will be in atrial fibrillation for years and years and have this ongoing risk of clots and strokes. Devices such as these are a great option for people that cannot take anticoagulation because of their risk of bleeding. These devices are not designed to treat their atrial fibrillation. That still needs to be managed with medications to control rate or rhythm, ablation procedures, but these devices are indicated in those who cannot take anticoagulation. Although these are very useful devices, and we do deploy them, their primary benefit is in those that cannot take anticoagulation because of a bleeding tendency. In most people, anticoagulation remains the best therapy to reduce their risk of clots and strokes. I think it's worth noting that even in people that have had a left atrial appendage occlusion device deployed to reduce the risk of clots and strokes, if they go on and have an atrial fibrillation ablation procedure, it's still very important for them to be anticoagulated for a few months after the procedure, because the ablation will denude and affect some of the lining of the heart tissue, and clot can form outside of this appendage. So we would be very keen for anticoagulation to be used uninterrupted for a period of time after any ablation procedure, even in the presence of these left atrial appendage occlusion devices.